But the other part that I wanted to address, some of you will have stints already. You can't get the stints taken out because they literally, as Joseph just said, they grow into it. But they do 3 to 4 a week of people that have had blocked stints, stints were too small, or whatever. They will treat those there. There's not many people doing that. But when they do those 4 to 5 very, very tough ones a week, trust me, that's a good place to go to get a procedure done because they're used to dealing with the complications and the tough ones that have happened somewhere else or even there.
Thank you. I've got one quick comment and 2 questions. You recommended going to the GPs and getting them and trying to get them to be more helpful. And I actually can't believe in neurologists, and I think that's where we should be going. If our Canadian Neurological Society is saying they do not even support research, I think there's a problem here, and I think pressure needs to be put there.
Well, I don't mind being really outspoken on this, okay? It's going to be tough sledding with the neurologists for a while because their egos are in the way. Someone stood up as a neurologist and said that this is a hoax. People that do it are a charlatan or a quack doctor, and that's absolute nonsense, but it polarized this entire country, and the neurologists are standing with that individual. There's tiny cracks among the neurologists, but trust me, it'll be a very unpopular he and she that finally breaks ranks. It's going to happen. We'll keep the pressure on them, but there's a twofold problem here. First of all, in my 30 years of practice, I didn't realize we had such a bad medical hierarchy, but we do. I'm really disappointed that one tiny group can hold the rest at ransom. I can't believe that happened, but it did, and it is. But the second part of that is, the family docs see us every day. Family docs aren't wizards at MS. Typically they'll have 3 in their practice in their lifetime. And MS is a very varied disease. But family docs get the circulation issue. As we teach them, and as we get continuing medical education points for teaching them at conferences, I'm hoping we can get that for the one in September, okay? And certainly we'll have it for the one in Florida next year, that they can start to learn about it. Because many of them are good people, inquisitive minds. But they're stymied because they have handed everything over to the neurologist. And we are being patronized by them. They are saying they own the brain, and therefore they own and know best for us. And that's not medicine. We are in charge of our own destiny as individuals or patients. And, you know, that's been forgotten right now. And it's going to be pressure from the people that are going to shift that.
I just think we're putting pressure on the GP who doesn't have the expertise.
Oh, no, I'm not saying we're trying to put pressure on them. I want to educate them so they feel comfortable in this zone.
But let's educate the neurologists.
Oh, I'm all with you. Yeah. But you first got to get them to listen.
Yes.
I'm absolutely with you.
2 questions. One is there anything you can do in your diet regarding the excess iron in the brain? Is there anything you can do as in a general practice? And my other question is, insurance, medical insurance, when you go down there, if you got in a car accident on your way to the hospital, where's the coverage that, because you can't get, my understanding is for insurance from here, it will not cover if you're going for an experimental procedure.
I disagree. I think your insurance from here will cover you for that car accident.
I was told not.
It depends on who.
Well, then I would look around for a different insurer, because some will cover you for it, and you can always go for your holiday. You took a side trip on a holiday, but if the insurance company has that written in, then don't go near them, okay? We carry travel insurance, Denise and I. I've had people ask me, who can I insure with so they will cover my complications of CCSVI? Well, fortunately, there is virtually no complications. It's exceedingly safe. So once we take that sting, or that elephant out of the room, then, you know, we're more relaxed with it. But I guess the other secondary piece for that, Pradax or Pradaxa, the one many people are put on now for the first 2 weeks, it's good not to have a car accident when you've had it. The GPs know that. We've had it about 2 years. It's a tricky drug to reverse if you have a car accident, all right? So Don't have one. Easy to say, hard to do. But maybe it's another reason why we have to keep pushing hard to have it here. There is no reason now not to do clinical trials in Canada. The data is there. The 4 or 5 studies that the MS Society is helping fund are just to see if there's a correlation between the two. All over the world, and most of the people they studied in Poland were Canadians. 8 out of 10, easy, okay? Have shown in 5 countries that the association between MS and CCI is 86 to 97%, okay? That's big numbers. The regular population, from a very good study, 7.5% in the regular population. We're reinventing the wheel. All it is stall and smoke and mirrors. Now I forgot this third part. Iron. Yeah. Iron is not easy, but I've talked to enough patients with MS. I've talked to enough young women who are worse right before their period. I talked to enough young women with MS. They go on iron supplements and they're worse. Until we figure this out, I would suggest you don't keep your iron at the top end of the scale. I would suggest you keep it in the lower third of ferritin. You can measure ferritin. I would suggest also that anybody with MS should have the blood test checked for hemochromatosis. It's not rocket science. The family doc can order it. Literally, they're ordering ferritin first of all. If the ferritin is off the charts, then they order another one as far as iron binding and saturation. And those are tests that they can order. I order both. They won't even do the second test unless the ferritin is high. It's okay. I got the number I wanted. And then I can advise the individual what to do with their iron or taking iron. My current suggestion as I watch people, keep an eye on the iron. Why is there more MS in women now? 2 possibilities. One is we're using iron supplements more. The second one might be, we've been relatively protected, or women have been relatively protected during their years of regular flow. However, if they've been on oral contraceptive and the flow has been much reduced and they stay on the same iron supplements, maybe that's where part of it's happening from. Maybe that's where part of the holiday happens with pregnancy, because your hemoglobin comes down and you have more flow through the body. And maybe you're also getting more flow through the jugular veins and that sort of piece. Because we've known for years there's a relative holiday during pregnancy. Why is that? But also, it's also my impression many women's MS worsens at the time of menopause. Is that because iron has crept down? We're going to learn more about this. What to treat with it currently? Well, if you're on the edge and you've got a mid-range ferritin, then the best absorbed iron is red meat. Okay, reduce the red meat in your diet if you're in that subset group. Someone asked me before we started today, their doc wants to put them on iron infusions because they've got a low ferritin. No, eat red meat. It's a lot better because it's iron bound to hemoglobin and it's extremely well absorbed. It's not constipating, it's not uncomfortable. I know women that have had iron muscle injections. They hurt like stink. No reason to go there. The next step, we'll find out as we follow this group with hemochromatosis that I've talked about and the other people with iron, is oral chelation. So I took my first course last week. 3 days of oral chelation. I don't know what the outcome will be yet. Although I do have it on the advice of a fellow Alberta colleague who treats hemochromatosis patients who typically get treated by being bled every week or 2. We've come a long ways in 300 years, haven't we? Anyway, they get bled, but they don't feel well. They're on a roller coaster. They feel crummy, they get bled, they feel better, and they're back on the roller coaster. A bit like relapsing remitting MS. So he now uses this oral chelation in conjunction with the bleed to do the other. So I don't think we can donate blood anymore with MS. I think it's one of the reasons they won't take it. So we can't suggest that to you. But, wait, watch, and see. You can certainly control the iron intake in your diet. And your body will move the iron from one place to another when it needs it. So that's one option, is to reduce your iron intake. So that means Women, even in their reproductive years, if they're finding they've got a fair bit of iron on their ferritin stores when they get it measured, and their hemoglobin's at the upper end of normal, then they may well, reduce the iron intake and try to bring it down gradually, let the body move it around. So that's as far as the stage is so far, but I think we'll know more when we have that meeting in September and when we have that meeting next February in Florida. We're going to know a lot more about that. We now have a hematologist on side with us. She was in touch with me because she wanted to meet Dr. Zamboni in Italy. We were able to tee it up. She's over there next week. She's a hematologist. She's following 76 people post venous angioplasty. And I like that as a safer term than liberation. But anyway, she's following them, and she has a protocol which has been approved by the Quebec College of Physicians and Surgeons. And so with working with people like her and experts in hemochromatosis, we're going to start to tease out this puzzle and we'll know more about it. It's not the whole deal, but for some of us it's a significant piece.
Hi, Dr. Code. My question is for you. I was treated 8.5 months ago, and physically I'm a rock star. I'm going to the gym. I'm actually building muscle. I haven't been able to do that in about 15 years. My one question is, I suffer from cognitive issues that prevent me from working, and I still have those. I was tested by my disability company's neuropsychologist. He proved they were still there. He recommended that my GP refer me to the brain injury clinic in Calgary to see if I could get some help with them. They refused me because I'm an MS patient, and they said there's no hope for MS. And my GP is sort of at the end of her rope. She doesn't know where else she can get me help. So I'm wondering if you have some recommendations that I could suggest to my GP.
Well, sure. So neurophysiologic testing, you've had it, and it still persists. And when I went down to see that character in San Diego, that hotshot neurologist, he thought I was pretty good, actually, because, I was walking and everything else was pretty decent. I went through the testing, I sucked. So he got it. He got it then. But anyway, it's hard to retrain. I would suggest, because it's 8.5 months you were treated, I would suggest you're undertreated. And I would go back and have treatment.
Okay.
And I didn't say it earlier, but if you're going for your second round, or your third, there's only about one place I would like you to go. There's a second and a third I would consider in the US, but that's it.
Yeah, I know.
Because you want to have people that are really good at it. You don't want to go to a vascular surgeon who isn't comfortable getting into the azygous vein. There's a lot of people now going down into Washington State, it's near us, okay? And the vascular surgeon is coming over from Philadelphia. He's flying in a couple times a week, and he's going straight ahead with venous angiograms. But it's not the best option. You want somebody who knows what they're up to, especially if it's a second go-round. I watched another woman who'd had 2 go-rounds in New York. Okay? She's even out of country. Second go-round, they had a terrible time getting into the azygous vein. No success, blocked off within a day or 2 after. Okay? You don't get 100 times tries in the tough azygous vein, I would suggest. Your second is your best option. First is best. The second, it's better to be there. So she goes this mid-month, to Michael Arata, and they will try again now that they've investigated it more. But sooner is better, and I suggest it's profound when it's better. I'm glad you got so many improvements. I started at the gym this week, hard to believe. Second time. I've been twice now, but I need to get to the gym. I've got severe osteoporosis. I've already got L1 depression, so I'm an inch shorter than I should be at this stage in my life. And many of us with MS do have osteoporosis, but I applaud you. Get back to the gym, rebuild those muscles. Rehab is a long journey back. But every time you use those muscles, or even think about using those muscles again, you're developing new pathways. So don't just be sitting here thinking about moving your toe up to get rid of your foot drop. It all matters.